there. So we are with Bay Area Regional Medical Center, the new hospital on Highway 3. It's the big blue glass building. You can't miss it. We've actually been open almost 4 years now, which is so exciting. And so we're thrilled to have this show to bring you guys some awesome stuff. In March, if you did not know, or April, I'm sorry. Why am I still in March? It's April. April is, and that was crazy to have Easter on April Fool's Day, right? Mm. So April is National Foot Month, and so today we're talking to Dr. Briggs, who is a foot and ankle specialist, and we're also going to be talking to Jerry and hearing his story. I can't wait to get into your story because you've got a really cool story. I can't wait to get into that. So we're going to be talking about all things foot and ankle. We're talking about ankle replacements. We're going to talk about bunions, plantar fasciitis, neuromas. I'm missing something else on my list of things, but Dr. Briggs, we'll just go through it, okay?
Maybe hammer toes.
Hammer toes, yeah. If somebody has any questions, you guys post them on our Facebook page, and we'll be happy to try to answer those on the radio while we're here today. So, Jerry, why don't let's just dive right in and talk a little bit, okay?
Okay.
All right, tell me a little bit about you.
Okay, born and raised in Wyoming, come down here in 1990. Got 6 kids, his, hers, and ours. Worked for Amoco, BP Marathon. Mm-hmm. Been with them since 1980.
Is that what brought you to Texas?
That's what brought me to Texas.
All right.
Come down here with the refinery.
You like Texas better than Wyoming? Side note.
It both has its good points.
Yeah?
I've never had to shovel any snow down here.
Yes, I know. Isn't that, well, minus like December, whenever we had snow, that was so weird. Mm. But you didn't have to shovel snow then. You just played in it, right?
Yes.
Okay, so you still work at Marathon.
Still work at Marathon. Hopefully retire here in about a year or so. Who knows how that's going to go, but
awesome. So let's talk about your ankle and what all had happened. So you ended up having to have a total ankle replacement. And that, for those of you who don't know, it's kind of like, think of it like people get a total knee replacement, but this is your ankle, right? So why don't you talk to me about what signs and symptoms you were having, what brought you to Dr. Briggs in the first place? How did this all happen?
This all started about, 10, 15 years ago when I was playing football with my son.
Football, it happens to everybody.
It's a tough one.
Dr. Briggs, do you see a lot of football players?
See a lot of football players, basketball players, soccer players, absolutely.
Okay, so football it was.
And I sprained it really, really bad. Went to ER. They said it wasn't broke. There's nothing you can do. And so after 3 or 4 days, 5 days or so, the swelling went down, and I was able to walk on it again. But fast forward about 5 years ago or so, it just started hurting. Mm-hmm. Not bad at first, and then until I seen Dr. Briggs there at the end, it just hurt every time I took a step. It just grit your teeth type hurt. Wake me up at night. If I turned in the bed, that ankle hurt, wake me up. Mm-hmm. And I said, enough's enough. Talked to some people that had the surgery, and they suggested Dr. Briggs. So I went and seen him, and he started off, he tried some injections first and worked that route. What else did we do?
I think we tried some bracing, maybe some nonsteroidal anti-inflammatories. That tends to be my go-to thing. But obviously that probably was not enough for you.
But do you walk for work too? It was a struggle at work and at home and everywhere in between? You were just miserable.
I was miserable no matter what. I just struggled through the day, just trying to make the end. So did you live on like Advil? Actually, I'd take some at night when I go to sleep, try to help me go to sleep. Ibuprofen, took a lot of that. But just mainly struggled through, gritted my teeth until enough was enough, and talked to the right people. They said, okay, my husband had this done.
Yeah.
So this is what you should look at.
Okay, and so when did you have your surgery?
It was last May.
So you're not even a year out.
Right.
So let's just go on the other side of this. So since you've had your surgery, are you able to walk better? Are you in any pain? Tell me about that.
I can walk well. It doesn't hurt to walk now. My ankle, I don't have to worry about my ankle. It does well. I have no problem. There's times when I walk a lot that it gets tired, but the more I'm past surgery, the better that's even getting.
And you were telling me earlier that you walk for work, and it's like a city block.
Yes, my unit is about a city block, big city block. I ride my bike over there, and then you just have to walk through the unit to do your work.
But working is fine. You're all good to go.
I have no problem making my rounds now, checking all the equipment. And
That's awesome. So talk to me about, okay, it's the day of surgery. Walk me through your whole day of surgery, the morning of, because I had to wake up at like 5 a.m. Did you have a really early morning?
I think it was early. Woke up, come into Bay Area. They got me, did all my paperwork and got me into a room and started with the IVs, and then after that was done, I went into the surgery room, and I was fascinated because being an old EMT, that just watching things go on was neat. Mm-hmm. Until next thing I knew, I was waking up in recovery.
Oh, that's awesome. So no problems. The surgery went well. Everything was good.
On my end, it went textbook.
Good.
Now, Jerry had a little bit of pain afterwards that we dealt with, but not too bad. I think it was the first 2 or 3 days that you really struggled a little bit.
Right. It was, if I was to use the medication to the lowest limit, the medication wouldn't have lasted. Mm-hmm. So my wife called Dr. Briggs, and he come down and wrote another prescription, and so I had enough to get through next 3 or 4 days. It was on a week. I think it was on Friday that we had the surgery.
Oh, yeah.
Yeah,
the first couple of days after surgery are just not fun.
No.
I know from that experience, too.
Yeah, and we did this outpatient. Nowadays, you can do this. I think you did not stay in the hospital, is that
No,
correct?
we had trouble with the insurance.
That's right. They wouldn't approve the inpatient.
Right.
Yep. So it's certainly insurance dependent. Some will require us to do a 1 or 2 night stay, and others want the patient out as soon as possible.
So my wife was really good taking care of me. She woke up every 4 hours and got me my medicine for the pain.
Isn't it awesome to have some family that does that for you? My husband did the same thing. He'd set an alarm. Yeah. Time to take some medicine. I was like, thank you. Let's get some more ice too, please. Because you don't know how much you really can love on some ice after you have surgery like that. Did you have to ice it all the time?
Yes, we used some ice. Just mainly kept it elevated.
Oh yeah, yes. Ice did it for me. If I couldn't feel the ice, I was in a lot of pain. We'll talk about my surgery in a little bit, though. We're talking about yours now. So was there anybody at the hospital during your surgery that really stuck out to you or made a difference?
Just watching everybody go about their business so professional, it was just very interesting seeing that done. Everybody knew what they had to do before lights was out, watching. It was interesting.
Oh, yeah. I loved going back there. Well, I mean, they were all like, hey, Abby, how's it going? Awesome. All right. Well, hey, we are going to have to actually go to a break in just a minute, which is crazy because our first segment is almost over. Isn't that awesome?
Yeah.
So we'll come back and talk to you a little bit more about your story, and then we'll talk to Dr. Briggs a little bit more in detail about what this total ankle replacement really means and how it acts, because some people, think that it'll be a peg leg or it won't really work, or you can't even do circles with your foot. So we'll talk to you a little bit about that, and also Dr. Briggs when we come back. And if you are live watching on Facebook or on the radio, give us some shout outs and send us some comments. We'll talk to you guys in just a few minutes. Stay tuned. We'll be right back to Bay Area Regional Medical Hour on Vinyl Draft Radio.
What would you like from your bank or credit union? How about a mobile app that makes banking simple? How about free online banking and mobile bill?
Over 20 years of experience, EventWise Productions has exactly what you need. With DJ services, emceeing, lighting, upgrade with additional decorative LED lighting. custom monogramming, even video DJ service. EventWise will make your next event one to remember. Even if you're planning a wedding on a budget, EventWise has a variety of packages to fit any budget. They even have AV available for your next corporate event. Sound, microphones, flat screens, the works. Check out EventWise Productions on Facebook to see pics, read their 5-star ratings, and more. Contact Mike Krell at 832-385-2669 or email mike@eventwise@gmail.com. EventWise Productions, your number one choice in mobile entertainment. Hey, it's Adam Smasher for Clear Lake Today. Look, when I'm looking to find a business, a service, or a place to eat in the Clear Lake and Bay Area, first place I look, clearlaketoday.com. All the info I need can be found easily on clearlaketoday.com. If you're looking to find a business, you need to check clearlaketoday.com first. If you own a business in the Clear Lake area, you need to make sure your business information is on clearlaketoday.com. To make sure your business news, coupons, videos, and more can be found on clearlaketoday.com. Contact Doug Meisinger by emailing doug@clearlaketoday.com.
Martin Roofing Industries Limited, serving the greater Texas coastal region and beyond since 1976. MRI is the choice for all your commercial roofing needs. Decking, sheet metal, retrofits, repairs, new construction, or custom fabrication. MRI combines over 40 years of experience with state-of-the-art equipment and a professional staff to deliver the highest level of quality and workmanship in the industries. Martin Roofing Industries, 713-664-7000. That's 713-664-7000 or on the web at mritexas.com.
Hi, it's Keisha. You may know me as the host of the Libra Lounge, but I'm also the owner of Before the Cake Events. We are a wedding and event planning boutique. We add a touch of magic in every detail, from custom designs to full day of services, and our packages can be tailored to fit any budget. Look us up on weddingwire.com and on Facebook and Instagram under Before the Cake Events. Sit back, relax, and enjoy your special day while we direct everything before and after the cake.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio. Hi everybody. Welcome back to Bay Area Regional Medical Hour. I'm your host, Abby Lee, and today we are talking about all things feet because April is Foot Month. Yeah. So we have Jerry here, and he was just telling us a story about how he twisted his ankle, so I'm interested to hear the rest of that. So Jerry actually had total ankle replacement, kind of like a knee replacement. So if you're interested in hearing the first half of his story, wait to go back and listen to the first half of that, because we're going to get to the rest of his story. And then we also have Dr. Briggs here, Dr. Patrick Briggs. He is a foot and ankle specialist. He's the one that actually did this surgery on Jerry, and he's one of only just two, I think, surgeons in this area that actually do this foot and ankle replacement surgery. So we're going to talk about who are the candidates, what's the criteria, and then we're going to talk a little bit more about other foot problems that most people have, like bunions, yay, like me, and plantar fasciitis, and all of that other stuff. So if you have questions about feet, y'all post them in the comments if you're watching on Facebook. Okay, so Jerry, you were back in a boot? Finish your story.
Yes, during the flood, our house flooded.
Oh, I'm so sorry to hear that.
It was during the night of the fight, and I called my wife and asked her where the water was. She says, up in the middle of the yard. So I says, I'm on my way home. We were in the process of moving. We had bought another house. So we was putting stuff up, trying to get stuff off the floor, because we've had this done before. We've been flooded before. And about 11:30, water started coming into the house.
Oh, no.
Yeah, about 1:30, we decided we better get out. So we walked 2 houses down to another house. It was a 2-story, and as we was walking, I twisted my ankle.
Oh no!
It slipped. We were up into thigh-deep water.
Oh my goodness! That quick at 11:30?
No, it was about 1:30. Then.
Oh, 1:30. Okay.
Yeah. So we stayed the night there, and I don't know. It was a couple of days later, I was able to get back into Dr. Briggs' office and said, "Man, we need to look at this," just so I didn't screw things up.
Yeah.
I was scared.
Did you see a lot of people after the flood who hurt their feet?
We did. We saw a lot of injuries, certainly a lot of infections too, which I didn't know that you were in deep water at that point. I just knew that you slipped. And
That truth
my
comes
heart
out.
is pitter-pattering right now. Because
Truth comes out.
God forbid if you were to get an infection, it can go right to that replacement that we put in, and it's a nightmare. So I'm so glad you're okay. I'm glad you spared that information
Just
from me.
blessed
back
right
then.
there.
Yes, we were good. Oh, I'm sweating.
So you were back in the boot for a little bit, and then you're better now.
Better now, yeah.
Since the hurricane.
Since the hurricane and after the I got out of the boot, just sort of been on it ever since, just tearing apart the house and getting it ready to rebuild.
Yeah.
But, other than in the beginning, it'd get tired, but it just, there wasn't a lot of pain as far as what I was having walking.
So talk to me. So after your surgery, talk to me about the recovery time, because it's this type of surgery is completely different than any other foot and ankle surgery, I think, on the recovery aspect of it. So we're usually after a knee replacement, they want you walking like within, I don't know, a couple of hours after the fact, really soon, just to get everything moving. Was that the case for you?
Actually, no, because he had to cut bone to move it out of the way. And for that bone to mend, it's just like a regular broken bone. I had to be off of it for a good 6 weeks. I was in a boot it wasn't a boot then. It was sort of a cast.
Yeah, I put him in a
soft
splint,
cast.
like a half cast.
Yeah, like I was in one of those too.
Yeah. I was in that for about 6 weeks. Kept the foot elevated. I had a little spot in the living room there that,
I was about to say, did you get bored?
that's a good thing about television. They got a lot of different shows on
Netflix all the way. That's awesome. So after your 6 weeks non-weight bearing, you were in a boot for a little bit?
now. Was put in a boot, and crutches. Was on crutches for...
We started partial weight bearing with you,
Yeah.
usually at 50%, and then progress them to 100% weight bearing over the next 3 to 4 weeks.
You didn't get a scooter?
We got one, but our house did fit a scooter.
Oh my gosh, I love the scooter. So, side note, the white marble floors in the hospital on the first floor? Mm-hmm. You can go really fast.
I think, Gabby, they make them with brakes now.
They do.
For that
Oh my
reason.
gosh, I got so fast and I was like, I really should slow down a little bit. So I had surgery, and we bought a scooter because I was like, if I'm gonna have surgery on both feet, I'm not gonna just waste money renting it, right? So yes, I definitely got the use out of the scooter inside the hospital.
Yeah, the scooter really didn't work for us. My wife trying to load it in the car, and when we go places, it just was tough. So I just stuck with crutches.
Yeah.
Made it through.
So about how long after your surgery were you able to walk fully and you weren't in any pain and things were just a lot better?
I would say after about 6 weeks or so, because I couldn't walk on it then. When we started walking, got the half weight on there. There wasn't really no pain in the ankle.
Oh, that's awesome. Even after 6 weeks?
Yeah, it just mainly the scar, the cutting of the skin and all that. There's some pain there, but
Yeah.
the ankle itself, because I had that pain before and it was horrible. It wasn't there anymore.
That's awesome. Okay, so talk to me about things that you're able to do now after the surgery that you weren't able to do before the surgery.
I'm able to walk what I want. Before the surgery, I had a bike at work. I rode that bike a lot. I'd ride it to wherever I needed, and it did what little walking I had to do. But now, I ride from our little satellite building over to the unit, and then I can walk the unit with no problem. Go up the stairs.
Complete change
Yes.
in how you're able to function every day?
Right. Before you walk, you're miserable. It's tough. You got to think and.
Yeah.
Yeah,
This
when
is
you're in
going to hurt.
pain.
Do I really want to
Yeah.
go or something like that?
Exactly.
Yeah. And now you're like, oh, yeah, let me go.
Let's go
I'm ready
do
to
this.
go. That's awesome. So before your surgery, were you able to make circles with your foot and point your toe and move it without any pain, or did it hurt just whenever you walked on it?
No, it hurt all the time. Like I said, it'd wake me up at night. I'd turn in the bed, it'd wake me up.
Ugh.
It was not fun. Anytime there was movement, it would hurt.
And you said you waited 5 years before you saw Dr. Briggs?
Yeah, at first, it wasn't too bad, and then it just slowly progressed to where it was, my teeth were getting flat from gritting them all the time.
I bet. Oh my gosh. So if you were talking to a friend or a coworker who was having some ankle problems, what would you tell them about this surgery and about Dr. Briggs, or both, or individually and both?
Well, I'd tell them, the surgery hurts. There's no doubt about that. But it's worth going through for the end means. If you have an ankle that's giving you problems, just go and talk to Dr. Briggs. He'll assess you and determine the steps to take. Like I said, we didn't go straight to surgery. Then after surgery, after recovery, your life will improve.
Significantly,
Yes.
apparently.
Yes.
Awesome. So how was your experience with Dr. Briggs?
It was great. Like I said at the beginning there, where I was having so much pain, and if I was to take the pills to get rid of the pain, like I should, I would have ran out of pills. And my wife was able to get a hold of him, and he come down on a Saturday and wrote another prescription, so I'd have enough pain pills, to take care of the pain. So that really impressed me right there, that if somebody would do that for their patients.
Yay, Dr. Briggs.
Thank you.
That's awesome. Well, he does.
And every time I went in and seen him, he's always very upbeat and knew what was going on and had the steps for me to take care of.
Yep. And the cool thing about it is that they can do x-rays in their office too. So it's not like, oh, I'm going to go see you and then I got to go get x-rays and then come back in a week or two or whatever and then see what's going on. Like it's one of the first things that they do. And I was like, when I first went in, I was like, oh, yay, this isn't going to be like a 5-step process to see what's actually going on with my foot or feet at the moment. So that was awesome.
Yes, that was really nice. You knew right away where you were at.
Exactly. Awesome. Well, thank you for sharing your stories today. And if there's anything else that we're talking about along the way, feel free to include that, okay?
Sure will.
All right, Dr. Briggs, talk to me a little bit about total ankle replacements.
Well, that's a big question,
I know.
Abby. So where do I start?
Where do you start?
So total ankle replacements, or TARs as we call them, been around 15, 20 years now. And there's probably 6 or 7 of them now on the market. But we've become a lot better at these over the last 2, 3, 5, 7 years, whereby they're much more predictable results. The success rates on these early on were hovering around that 70 and 80%, and now survival rates on these implants can go 10, 15 years, and we're at about a 90% survival rate on these things. So I think technology, more and more are getting trained on this. However, like I said before, there's not too many of us that actually do these. I think there is a risk associated with it. But as these implants are getting better and the training is getting better, we hope to educate more and more folks about these so that it will become more mainstream.
So what were the risks prior?
Yeah, certainly that the implant would break down, that infection would set in. A lot of these implants are put in through what we call an anterior approach, or approach through the front of the ankle. And this is a very difficult spot to heal. With Mr. Warren's, we ended up putting
His was on the side.
That's right.
We got to see your scar earlier.
Yeah,
that was
yeah.
fun. You didn't see mine, though.
So with Mr. Warren's, we put it in the lateral side, or the outside. And one of the big advantages of this is it's a nicer healing wound, a nicer healing incision. The disadvantage is, I have to break the fibula, but the fibula does heal very nicely in these folks. And if I were me right now, I would probably have the same approach, because the chance for wound healing complications are a lot less going this way. Okay,
So when did they change from going from the anterior to the side?
This technique came about, been approved in the States 4, 5, 6, 7 years ago now. Yeah, it's been done in Europe quite a bit, and now it's introduced in the States. Some are in favor of it, some are not. Certainly, like anything, there are more than one ways to skin a cat. And this is the way I wanted to skin Mr. Warren, so this is the...
Oh my my gosh, that
This is-
sounds horrible.
It sounds horrible, but this is, I
no,
think,
but he's good. He's good. He's happy.
It worked well.
yeah, and it does, and it works in my hands, so that's what we do. However, I do the other techniques as well, just depending on the patient and what I think they'd be benefit the most.
Oh, so do you do total ankle replacements on younger people? So if they only have a 10 to 12 year, 10 to 15 year lifespan, do you do that on younger people?
That's a great question because it's truly indicated for somebody maybe 55 and older. However, if you get a really bad ankle in somebody that's 41, I just did one maybe 10 days ago now in a lady that was 41 years of age.
Yeah.
But her choice is, because of the amount of pain that she was in, was either to fuse the ankle or to have a total ankle replacement. Take your chances, and maybe 10, 15, 20 years down the road, maybe we have a better replacement that will last the rest of her time.
Okay, so I'm going to have to stop you right there because we have to go to break. That's crazy how fast these go by, right? I know. So we'll come back on the flip side and talk way more into detail about total ankle replacements and get into some of the other foot problems that a lot of people have. So if you're watching or listening, y'all stay tuned for just a few minutes. We'll be right back talking to Dr. Briggs about total ankle replacements. We'll be right back to Bay Area Regional Medical Hour on Vinyl Draft Radio from the ACU of Texas studio.
Are you tired of shaving, tweezing, and waxing that unwanted hair? Well, guess what? Houston Plastic and Reconstructive Surgery has advanced and affordable laser hair removal. We can treat your chin, upper lip, legs, underarms, bikini, and more, and it won't grow back. So throw away those razors that make your eyes water, because there's a faster way to groom your way to gorgeous. Call us today, 281-282-9555, or online at myhprs.com. Say goodbye to unwanted hair for good.
Do you ever wonder how every insurance company seems to boast about having the best rate for you? With so many companies, how is it possible that they can all have the best rate? Well, the reality is they're all telling the truth. Kind of. You see, each insurance company has a different set of target customers that they're looking for, so each company will have the best rate for someone. The challenge is finding the one that likes you the most. Perfect Policy evaluates you through more companies than any other insurance agent, and that's how they find the best policy for you. It just makes sense. More options means better value. Contact Perfect Policy today.
We the people have a right to superior cocktails, and Preamble Lounge and Craft House would like to welcome you to a new cocktail revolution. Our speakeasy-inspired lounge offers signature craft cocktails in an intimate setting. With a wide selection of high-end spirits, infusions, barrel-aged beverages, and cocktails, there is something for every patron and every budget. Preamble is located at 20801 Gulf Freeway in Webster and open Monday through Saturday from 4 p.m. to 2 a.m. Preamble Lounge and Craft House, a new cocktail revolution.
Hey, this is Kat Clemens with Hope Village. Join us on April 21st at 6:30 p.m. for our 13th annual Passport to the World of Wine, featuring two-time international champion of Magic, Ben Jackson. Tickets are $75 and sponsorships are available. To get your tickets to a night of magic and wine, visit hope-village.com or call me 281-400-2011.
Tucked away in the side streets of Kemah, the white exterior of Kemah Steak Company radiates a timeless essence. Behind the doors, a casual yet elegant dining experience welcomes their guests. They make sure your dining experience is nothing but the absolute best. Come in today and see why Kemah Steak Company is your perfect getaway. Kemah Steak Company is located at 707 Bradford Avenue in Kemah. Contact them at 281-334-9463. Reservations recommended on weekends.
When was the last time you went to the dentist? 1 year? 3 years? More? Most of us get so busy that we don't go to the dentist like we should. Well, maybe it's because you're not going to the right dentist. Call Dr. Teakin and his staff at Teakin Smiles right here in Link City, 281-334-4944, or go online to teakinsmiles.com, because seeing your dentist shouldn't be a pain.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio, coming live from the ACU of Texas studio. Live? No. Hi everybody. Welcome back. My name is Abby Lee, your host of Bay Area Regional Medical Hour, and we're talking about all things feet for Foot Month in April. Yeah, we just got done talking to Jerry about his story about his total ankle replacement. We were talking to Dr. Briggs about all of the nooks and crannies about this procedure, who's a good candidate, what are the indicators. That's what we're about to talk about. So let's just finish where we were and talking about indicators for needing an ankle replacement.
That would be me, I guess.
Yes,
you're
like this is like our last live stream, and Dr. Briggs is going to smile sometime soon.
I will smile. So yes, Abby, there are some indications and contraindications. Certainly, if you're really obese, that is an issue. Diabetics that are poorly controlled, poor blood flow. If you're a smoker, those are all contraindications to putting a total ankle in. So we like to see relatively healthy, good blood flow down to the lower extremity, a non-smoker, and if you are a diabetic, it's not contraindicated, but that you make sure your blood sugar is under good control prior to this procedure. There are certain alignment issues within the foot and ankle as well. If the foot is malaligned or the knee is malaligned, we have to go ahead and correct those issues prior to putting the total ankle in next. And sometimes those can be corrected concomitantly or at the same time.
Okay, so we were talking about younger people and ankle replacements too.
Sure.
And sometimes it's good and sometimes it's bad. And you were talking about a 41-year-old woman, and I think that's where we left off the last time.
Yeah.
Talk to me about her.
The last lady I did was a 41-year-old. When we were first trained on this, nobody wanted us to put it in anybody younger than 55. They wanted to wait 55 to 60 because the lifespan of these total ankles was 10 to 15 years, or at least that's what the only literature that we had available. Well, when somebody comes to me that they're 41 and complains of severe pain following an ankle fracture, and that was fixed 5 to 6 years ago, and she can't walk anymore, the alternatives are an ankle fusion or that of an ankle replacement. And we talked it out, and I thought she would do better with a total ankle replacement than an ankle fusion, with the idea that later on down the road we may have to replace that ankle or replace the polypropylene that's inside the ankle replacement to provide a better long-term care.
So you think in 10 years that there will be a better ankle replacement than what's currently out there that she could benefit from and just get a newer model? The upgraded one?
I don't know what evolution we're on now, but we've gone through a bunch of them. And I think we're getting a lot better at them than we certainly were 10, 15 years ago.
So if I am having a lot of ankle pain, what would you say would make me qualify as a candidate for that?
Sure, somebody that's in the late 40s, early 50s, even 60s, pain every day, pain that's been worse over the last couple years. You've tried anti-inflammatories, you've tried injections, bracing, physical therapy. You want to stay relatively active, and you want to continue to walk, and you're a non-smoker, and if you are a diabetic, you're under good control, you'd be a good candidate.
You were talking about people, obesity too, not being a good candidate.
So if they're morbidly obese with BMIs over a certain range, they're not great candidates because they'll wear these implants down. And certainly healing potential in the morbidly obese is very difficult.
Okay, so whenever you look at their x-rays, are you looking for like a bone-on-bone type thing? Or what exactly are you looking for whenever that indicates someone needing a total ankle replacement?
Yep. Usually we see cartilage wearing if we were to get an MRI. However, if we see bone on bone with very little joint space and they've had previous trauma, radiographically they may be an excellent candidate for an ankle replacement. But again,
and you said that you were bone on bone, right?
Yes.
Ow.
Yeah,
Ow.
I think I remember your x-rays. He actually had some bone spurring quite a bit on the front part of his ankle as well.
Yeah. Aren't you glad that you got that, huh?
Very definitely glad.
Awesome. So talk to me about how long is surgery and what all happens?
Usually we can get surgery done in about an hour and a half, sometimes a little bit sooner than that. But after our consent and long discussions with the patient, the weeks prior to surgery, making sure that they're ready, not only mentally but physically, and everything's tuned up. They present to the hospital. I do a cursory check with them again. We talk with anesthesia. Oftentimes we'll give them a block behind the knee, so by that the whole leg is numb, so that when they do wake up, they're not screaming, yelling at me, and at least they're numb for at least 6 to 8 hours. And then
That helps, side note. Oh my gosh.
Yes, if patients are not numb after surgery, they're going to come find me very quickly. And it's not a comforting feeling.
Yes.
And then we're wheeling back to the operating room. We have a very sterile environment. We have all the nurses will stay in the room for the duration of the procedure, as well as the anesthesiologist. They'll put them to sleep. A tourniquet goes around their thigh, and then we go to work.
Okay, so what's the recovery time after the fact? Is it generally what Jerry had, 6 weeks non-weight bearing, and then 4 weeks in a boot?
So depending upon your approach, if we talked about two different approaches, one on the outside part of the ankle and one on the front part of the ankle. If you have the one on the front part, it's about 3 weeks non-weight bearing, because we need to allow that incision site to heal. And then we go partial weight bearing. Jerry's was a little bit longer, but I was okay with that given the fact that the chance for infection was less, skin healing problems would be less, and my ease at which I could address his ankle would be better for some surgical preferences, I should say.
So is that what you do all the time going through the side now?
I don't. I do anterior approach and I'll do a lateral approach depending upon the patient.
Oh, okay.
Sometimes it depends upon access to the ankle joint and what I think I can get done. If it seems to be a tighter ankle, I'll go laterally. If it seems to be something I can get to the back part of the ankle fairly easy, I'll go anteriorly.
Okay. Is there anything else you want to talk about on total ankles before we move on to some other foot problems?
It's certainly not for everybody, but I think the indications are fairly stringent. However, I think you can really improve someone's quality of life. The ankles that I end up fusing, they thank me for. The ones I end up giving a total ankle for or operate on for a total ankle, they often give me a hug. So I tend to like my total.
You like
ankle.
the hugs.
I like the hugs. The others, the fusions, they're like, thanks. I don't have pain, but I walk a little funny. My total ankle patients, they seem to walk a little bit better, a little happier. They're back to more of a quality of life.
So what would make you choose a fusion over an ankle replacement?
Some of the criteria that we mentioned before, if you have really a malaligned ankle joint that I don't think I can correct through the foot or higher above, I'll end up fusing the ankle. Certainly if they're diabetic, if I think the risk is too high to put a total ankle in, I'll go ahead and fuse those patients.
And so with a fusion, you basically can't move your foot, like point it, or I'm doing this with my hand. If somebody is listening, they can't really see what I'm doing, but make circles with your foot and things like that, right? They won't be able to do that?
That's right. You have no motion at the ankle joint. You have motion in what we call the joint right below it, the subtalar joint, and you can certainly move the toes and parts of the foot, but you have, very little motion. Folks tend to pick their foot up and set it down on the ground and walk what we call an asymmetric gait. So their gait doesn't look normal. Whereas when you watch Mr. Warren walk, he looks fairly normal.
He was great. Yeah. You wouldn't have noticed unless he started pulling down his sock and you could see the rest of his scar.
So that's one big advantage.
Okay, awesome. Okay, so you ready to talk about bunions, my favorite topic ever?
This is Abby's favorite. You are well versed in this topic.
I think so.
Yes.
So for those of you who don't know, I am actually a patient of Dr. Briggs also. I had both of my bunions fixed on both feet. And you can't see my feet right now, but I am in heels, so it is possible to be back in high heels. They're not that high, though. They're not 6-inch heels, by the way. They're more like 3. Side note. So, I'm not really going to go into the 6-inch heels by far. But, okay, so let's just get this out of the way, because most people, when you say bunions, they're like, oh, well, that's just because you wear those high heels, Abby. So let's just set the record straight, right? How are bunions really formed?
Sure. Bunions are a hereditary condition. 3/4 of bunions occur in women. It's what we call an atavistic trait, or it's through evolution that we've developed this. I won't tell you where we've evolved from, but you can kind of guess. So I say women are more like, what, Abby? I told you this before, right? Who are women more associated with than men?
I have no idea where you're going with this. I don't remember, so just say it.
I'm not going to say it. It's probably not appropriate for the radio, and I'll probably get in trouble.
Okay.
Anyway,
let's not get in trouble.
We're not going to get in trouble. It's an evolution that it's occurred, and you have this trait.
Now I'm going to be thinking in the back of my head this whole time, what are you saying? Okay.
Yeah, you know about it. I've talked to you about it before.
All right. But it's not high heels.
But it's not high heels. Shoe gear does not cause bunions. If you go to some other countries where they don't wear shoes, you'll see some very rampant bunions out there.
So thank your parents, basically.
You can thank mom, dad, grandma, and grandpa.
Yeah, for your bunions. Okay, so let's just go over the signs and symptoms that people would have whenever they have really bad bunions and they need to see you.
Absolutely. Most of the time it's pain in the big toe joint. They see that big toe drifting in an outward direction, and they see a bump on the inside part of that foot. Most of the time it is painful in shoe gear. However, sometimes folks will complain of pain out of shoe gear. Sometimes they complain of pain in the ball of the foot, and that's secondary to the bunion itself.
Yeah, and so we were talking earlier about how some people cut out a place in their shoe for their bunion to stick out. So if you can look at your foot right now and look at your big toe, and on the side, on the outside of your toe, down a little bit, there's a little knob or a little. You are so much more well versed at this than me, but I'm going to speak in Abby's terms right now. So, sometimes that little knob pokes out a lot, and sometimes it doesn't hurt people, and sometimes it does. And
well, there are multiple creative ways that people have to get out of pain, and I was telling you earlier before the segment that some folks will make a little cutout on their shoe in the leather, and they'll see the bunion.
And paint it brown?
Yeah, and paint it. That was Jerry's idea, which I love.
That was so funny.
Yeah, just paint that brown and it looks normal. Never know.
Oh my gosh. So how do you know if someone's a candidate for surgery when they have bad bunions?
Pain will dictate treatment. So certainly if you have an asymptomatic bunion or a bunion that does not bother you and you can do everything that you want to do in life, leave it alone. The science doesn't dictate fixing these bunions. Bunion pain will bring somebody into the door. There are some folks out there that will just want to be educated about bunions itself, but most of the time, almost all the time, at least in my hands, it will be because it is painful for them. Now, a bunion may cause other issues within the foot, so that their pain in the foot may be secondary to the bunion, so we may have to address the bunion in addition to addressing the other issue that they have in their foot.
All right, so let's take a break real quick. We're going to come back and talk about bunions, plantar fasciitis, neuromas. I want to talk a little bit about pregnancy because we've been talking a little about OB, and I am pregnant too. So, and feet change when you're pregnant is so weird. So I want to find out how that really affects your feet. So you guys stay tuned. Come back in just a few minutes. We'll cover all of that. We'll see you back here in just a minute. We'll be right back to Bay Area Regional Medical Hour on Vinyl Draft Radio.
Are you looking for a high-level business networking opportunity? Then look no further than Vinyl Draft. Mark your calendar for 7 p.m. on the third Tuesday of each month and join Doug Meisinger and Bertrand McHenry along with co-host Kelly Williams for a totally unique networking concept. No selling, no passing out business cards, just a place to mix, mingle, and create relationships with Clear Lake area's top professionals. All of this with the fine food and craft cocktails of Preamble Lounge and Craft House and an all-vinyl LP soundtrack. And remember, it's Vinyl Draft. Wear something nice.
BlackRifleCompany.com. Over 24,000 shooting sports products just a mouse click away. BlackRifleCompany.com. Handguns, long guns, optics, ammo, and more. BlackRifleCompany.com. Enter code RADIO10 at checkout and receive $10 off any order of $99 or more. BlackRifleCompany.com. Your shooting sports specialist.
Is your medicine cabinet overflowing with unused and expired medications and don't know what to do? Call the Bay Area Alliance for Youth and Families. Ask about free medication disposal pouches with a patented technology that neutralizes the drugs and makes them safe for disposal. Or you can save the date for Saturday, April 28th, when they'll once again be hosting medication take-back sites across the community. For more information, go to ccisd.net/alliance or call 281-284-0370.
Lori Coppett.
A name you can trust.
Lori Coppett.
A senior mortgage loan originator with Prime Lending, serving the Clear Lake area for over 28 years.
Lori.
Why are you saying it like that?
Coppett.
Helping hundreds of satisfied clients with their home loan needs.
Lori.
Seriously?
Coppett.
If you're purchasing, refinancing, or renovating your home, visit lcoppock.com to get the professional service you need. NMLS number 176539, Equal Housing Lender.
Lori Coppett.
Oh, for God's sake.
We the people have a right to superior cocktails, and Preamble Lounge and Craft House would like to welcome you to a new cocktail revolution. Our Our speakeasy-inspired lounge offers signature craft cocktails in an intimate setting. With a wide selection of high-end spirits, infusions, barrel-aged beverages, and cocktails, there is something for every patron and every budget. Preamble is located at 20801 Gulf Freeway in Webster and open Monday through Saturday from 4 p.m. to 2 a.m. Preamble Lounge and Craft House, a new cocktail revolution.
Hey, it's Adam Smasher for Clear Lake Today. Look, when I'm looking to find a business, a service, or a place to eat in the Clear Lake and Bay Area, first place I look, clearlaketoday.com. All the info I need can be found easily on clearlaketoday.com. If you're looking to find a business, you need to check clearlaketoday.com first. If you own a business in the Clear Lake area, you need to make sure your business information is on clearlaketoday.com. To make sure your business news, coupons, videos, and more can be found on clearlaketoday.com, contact Doug Meisinger by emailing doug@clearlaketoday.com.
Welcome back to Bay Area Regional Medical Hour on Vinyl Draft Radio. Hi, everybody. Welcome back. My name is Abby Lee, your host of Bay Area Regional Medical Hour, and we're talking about bunions with Dr. Briggs. Woohoo! And if you're interested in hearing a little bit more about total ankle replacements, go back to the beginning, but not yet. Wait for this last segment, and then go back and listen to Jerry's story about his total ankle replacement. So, okay, we're talking about bunions and surgery. So my surgery was different than what I originally thought that surgery would be on your bunion. So I just thought that you would just go in and shave off that excess bone that's like sticking out Never Land over there and hurting so bad. But it wasn't. And why don't you explain what exactly you were doing with all of that hardware in the foot?
Sure. So bunions are really a drifting of a metatarsal. It's the
drifting of the big toe bone.
Big toe bone.
For those non-clinical people out there.
Yep. And the bone behind the big toe. Okay, so the bone behind the big toe goes one way, the big toe goes the other. If we were just to shave that off, the joint would still not be in great alignment. You may not have the biggest bump, but that bump would soon return at some point. So what we actually do is we try to realign that whole bone right behind the big toe, or the big toe joint, and we try to put it in its proper place. There are several ways to do that. There must be about 30 or 40 different bunion-type procedures out there.
Oh, wow.
But in the younger patients, like Miss Abby, we tend to realign that whole metatarsal by fusing the metatarsal to the bone behind that one, because we believe that joint is causing the bunion deformity itself. So we do that with plates and screws, etc. But we're now walking these folks, including Abby, I think at 2 or 3 weeks post-op. I think I allowed you to walk.
Yeah, it was 2 weeks.
2 weeks post-op.
2 weeks non-weight bearing, and then I was more like 3 weeks walking in a boot, and then walking in like a tennis shoe after that.
Yeah. So what point did you start walking in a tennis shoe?
At about 3 weeks. Well, 5 weeks post-op.
Yeah, 5 weeks post-op.
Yeah.
That's really, really good. You're fantastic.
Yeah.
So that was the big thing a number of years ago. We were trying to find constructs that would allow folks to walk faster and faster. And we have come up with some that allow patients to walk following this procedure at 2 weeks post-op, which is really exciting. When I first came out of training, it was more like 6 to 8 weeks, because we didn't trust that the hardware would hold our body weight.
Wow.
And we believe that that would break down. But nowadays, we have better constructs for that.
Yeah, and you can run, and you can cycle, and you can have babies, and all sorts of stuff after you have bunion surgery, so it's all good. Okay, so let's talk about people with diabetes need a podiatrist too. Why would someone who has diabetes need a podiatrist?
Sure. Diabetes can play havoc with our whole body, particularly the poorly controlled diabetics.
Mm-hmm.
And if diabetes is not in good control and your blood sugars are out of control, that's deleterious or harmful to not only our nerves but also our blood flow to our feet. And if you can't feel and you don't have good blood flow, you can lead to ulcerations, sores, loss of feet, loss of toes, loss of legs.
And we don't want to lose any feet or toes.
We don't.
Seriously.
We don't.
So you go to Dr. Briggs if you don't want to lose your feet or your toes.
I like to save feet. More feet to work on.
Yes.
Save the feet.
That's awesome. Okay, so let's talk about flat feet for a minute. So you see a lot of people with flat feet. What are their signs of what kind of pain are they in?
Sure. A lot of people don't have any pain, but the patients that do see me that have a flat foot, they may also have a bunion with it, but they'll complain of arch pain, knee pain, ankle pain, lower back pain. and oftentimes it could be stemming or arising from the foot itself. So we'll try to address that first conservatively. Sometimes we just try an orthotic, sometimes some certain stretching, some exercises that can be beneficial. If that doesn't work, then sometimes a reconstructive type procedure may benefit them.
So I had a side note. I have a friend that had this surgery, and he showed me his. So before we went live, we were all showing each other our X-rays of our feet and all the hardware we have in it. His foot, though, his X-ray was insane. Like, that was crazy. So why don't you explain how you reconstruct that whole foot to actually give it more of an arch?
Yeah. Now, Abby, there's several procedures that we can use in that. So it's difficult. We'll start with the hind foot first, or that area of the foot that's below the ankle, and we'll have to make sure that that heel bone is sitting underneath the ankle joint itself. If you look at somebody from the back of the heel, and if their heel kicks in an outward direction, we have to realign that heel bone. Sometimes we do that with fusing joints. Sometimes we do that with bone cuts. Sometimes we do that with tendons. So once that hind foot is realigned, we then look at what we call the forefoot, or that at the toes and back to the bunion area. We'll then address that to make sure that is plantar grade or parallel to the weight-bearing surfaces. And we do that through a series of cuts or tendon transfers, etc. So it all depends. Not every flat foot is the same. Multiple types of flat feet are out there. We'll look at what we call planal dominance, or in what plane is that flat foot dominant end, and that will help procedure selection.
So his X-rays, he had stuff all over the place. Like, obviously
Sure.
there's a method to the madness of things that were in his
I promise. There is a method.
But after the fact, he was like, oh my gosh, I should have done this sooner, because he was like, I couldn't hardly walk at all. And I could see him walking, and he was struggling. And he was really excited to have the surgery too. So
Great.
that's awesome. Okay. Anything else we want to talk about on flat feet?
I don't think so. I don't think all flat feet are bad. I just think that if you have issues, not just within the foot itself, it may be arising from the foot and maybe causing your hip pain, lower back pain, knee pain. So I think it's important to get that properly worked out.
Okay, so let's talk about you for a minute. Yay. What's your background in education?
Sure. Went to University of Colorado. Actually, I'm born and raised in California, and then I went to University of Colorado at Boulder and graduated in kinesiology, exercise phys, and then applied to podiatry school and was accepted and went to San Francisco, where I studied 4 years there, and then did my residency down in Los Angeles, affiliated with UCLA, and then came to Houston for some surgical training the last 2 years of my residency, and I've been here ever since, except for a 3.5-year stint up in Alaska. And,
that sounds like fun.
Yeah, my wife had an opportunity to work up there, and I said, I'll be that trailing spouse. I'll go work with her.
I remember you talking about having like the different things that you see in Alaska for feet.
Hey, a little more frostbite and, stuff like that.
Oh my gosh.
Eskimo injuries.
We're glad that you're back in Texas for sure.
Well, thank you.
So why did you choose to go with Texas Gulf Coast?
So I knew the other podiatrist that's there. It's Dr. Marcus Giacomuzzi. I've known him since residency, but I wanted to be part of a multidisciplinary group. I saw that what they were doing down at Texas Gulf Coast, and I thought it'd be a neat opportunity. Awesome. And then with the new hospital coming on board, I thought that was even better. So
yay.
I've been very happy there.
We love having you perform surgery at the hospital as well. So if someone wants to make an appointment with you, how do they do that?
It's a great question. You can go online. You can make an appointment with me, or you can go to 281. What's my phone number? 604
1300.
1300 is the main number, but don't call that number. There's a better number, 281. Oh gosh.
Just go to the website.
Go to the website. Go to Texas Gulf Coast Med, and you'll see the website there, and you can make an appointment right on that line.
There you go. And you can usually get in pretty fast. So highly recommend you. All right, you guys, we'll be back next week, next Tuesday at 4 o'clock for another Bay Area Regional Medical Hour. We're going to be talking about in vitro fertilization and OB, and we'll be talking about, I have so many questions about that. So you guys come back next week at 4 o'clock. We'll see you then. Thanks so much.